started, guys. So thank you for those of you that hopped on here at 8:30. I did not mean to confuse you guys, and I appreciate it very much. We're going to talk about skin analysis, which is one of my favorite topics because I have actually been doing this a lot. With a lot of our clients who have been texting me pictures of their skin and their face and different things going on and asking, what do I do about this, that, or the other? Well, we're going to talk about that. So skin analysis is a big thing. You do not necessarily have to have someone in front of you sometimes to do a proper skin analysis. There's a lot of pictures you can look at. Of course, you want to ask them the proper questions too. But of course, when we are back in the classroom together, we're going to look at the client in person or each other in the classroom and decide what we need and why that is. That is probably one of your biggest questions. So if you do have a question about something on your skin or something that is related to a friend or a family member or something where you just thought, well, I need some help with this. What is the proper way to go about treating this skin condition? I need to figure out how to do a proper skin analysis. I can help you with that. So send me some pictures. I love, love, love to help come up with care plans, as you guys know, and do a proper skin analysis so we can actually treat the skin appropriately, right? Okay. So let's read together. Skin analysis is one of the most important aspects of a facial service, as the esthetician will determine what skin type the client has, what products are deemed appropriate to its conditions, and what treatments are needed. So true. So let's break that down a little further. Determine what skin type the client has. So remember, guys, there's only two types, truly, or three, we can say three, types of skin types, right? So it's either drying, oiling, or combination. I'll say that again. There's three skin types: drying, oiling, or combination. And when I say combination, some of you may experience this where you're a little bit more oily in the T-zone, but very dry around here, or whatever the case may be. Or you're kind of evenly distributed with oil. You can be dry sometimes of the year. You can be oilier during your cycle or whatever else is happening. So that can be combination for sure. But if you know you're dry, then you're dry, right? Or for those of you that just literally are oily all year round, you know that that's genetically predisposed and something that you have happening for sure. So keep that in mind, that is what we need to focus on there with skin analysis. We know that we can ask that client that question: are you dry, oily, or combination? That's question number one. And then it says what products are deemed appropriate to its conditions. So skin types are one thing. Skin conditions are different. So skin conditions are things that you can actually treat, okay? Such as skin sensitivity, that is treatable, believe it or not. What about rosacea, telangiectasias, or broken capillaries? Same kind of stuff in, overall concept of it. So broken capillaries can be those little red, veins around the nose that kind of break and you see them. It could be from rubbing your nose during allergy season, or it can be just disposed genetically. A lot of Fitzpatrick type 1 and 2 can get a lot of the redness around the nose. You can have distended broken capillaries, which are also known as telangiectasias. Same thing, but then rosacea is really where you have a ton of broken capillaries or a good bit of telangiectasias almost in one solid area. So the skin in the cheeks looks very red and flushed all the time. So you think, oh, well, my skin's just red. Well, if you look at it up close under a mag light, you can see the fact that they're made up of a ton of broken capillaries. Am I right? So just keep that in mind and you're good to go. But another thing in terms of conditions, we said what? We said sensitivities is a condition, it can be treated. We said rosacea is a sensitivity, or excuse me, is a condition that can be treated 100%. Oftentimes veins, though, can be treated better with laser facials. I will tell you that, and we can get more into that later. But another skin condition would be hyperpigmentation. We can absolutely treat that, but haven't we discussed that a lot of hyperpigmentation is not necessarily sun-induced, but hormone-induced for a lot of females? And, that's okay. We just have to make sure that the client actually treats the root of the problem. Otherwise, it can come back. So yes, it is treatable, but where is it coming from should be the first course of action and determining that answer for your client, right? And then, of course, another condition is acne. Acne plagues people all the time, whether it's, teen acne, which is a specific sort of hormone-induced acne, to just adult acne, which can be way different in hormonal-induced acne for sure. But then also just acne from, wearing really terrible makeup or not washing your skin properly, or people that just frankly are in terrible, work environments. Sometimes they work in chemical plants or labs, or they're working in fast food around a bunch of oil and grease and, different things like that. That can affect your skin and cause acne as well. We also know that stress affects acne big time. So that's a major condition that we treat. So it says there, we're breaking this down like crazy, aren't we? What products are deemed appropriate for skin conditions? That is a learned thing, and you learn that by studying your ingredients. So everything y'all have been taught digitally so far has been really great. I've actually enjoyed this digital learning because you really get to sit here and think on your own, why is this going to be that? And how does this treat that? How does this ingredient work with that skin condition or whatever the case may be? So if you have any specific questions about ingredients for a skin condition, please shoot me a text or email now, because that is something I want to answer for you. I don't want you to walk around during your training at Southeastern Aesthetics Institute wondering, about what treats what skin condition. Please ask. I want to help. And it is something that we have discussed, but I know that this is very fast paced a lot of time with something that we're talking about. So if you have a specific question, please ask. And then the last part of it says what treatments are needed. So skin analysis chapter, to me, always ties in so nicely with the client care plans that we do. So we have a nice opportunity towards the end of this to really discuss care plans one more time. And I wanted to make sure I had enough time to discuss this because we have our advisory committee meeting today at 10 o'clock, which is digital too. So I wanted to make sure you guys had my attention and we're good to go. All right, so then it says proper consultation allows the esthetician the opportunity to ask questions about the client's health and skin concerns and advise them on proper protocols and plans of action for true results. Yes. Consultation, guys, that is a big thing. I need you to picture yourself actually doing this. And I think for people that have never had face-to-face interaction in a work environment with somebody where you're the expert, right? And you're telling someone what to do, if that's a big question of concern, let me know, because I do work differently with people that have a little bit more stage fright in that area. When you're talking to people, you have to be comfortable shaking their hand, or of course doing the elbow tap right now, right? Or just looking them in the eye and saying, okay, this is what I see and this is what I recommend that you do. Okay. It is important to gain that confidence. And I remember going to aesthetics school when I was 18, 19 years old or whatever it was. And I was also going to college for education, believe it or not. And then I switched over to business. But keep in mind that that was something that was nerve-wracking to me. I wasn't as confident then. Now I can talk to anybody about any little thing and I just don't care. I have mastered the art of not using the word like every moment of the sentence, or using the word and I'll say it here and there. I'll probably say it more now that I've mentioned it, but we want to work on those things. You want to work on your public speaking skills because consultation is so key. It really is. So one way to practice this, by the way, is to think of a client when you're driving down the road in the car, and typically you're by yourself, unless you have your kids in the car and they just don't care. They're back there doing their own thing, right? So make up a client and their skin conditions and concerns and say, okay, well, Susie Q has this. She's coming in for consultation. So we're going to pretend like we're talking to Susie, and we're going to say, okay, driving down the car, we'll say, okay, Susie, nice to meet you. My name is Courtney, and we're going to treat you for your skin concerns and conditions today. All right. So you said that you are coming in with acne grades 3 and 4, and it is due to what you think are hormone-induced acne fluctuations. So we're going to discuss that. Of course, I am not the hormone expert, but I know enough to recommend and refer you to people that really can help you with that piece of it. So I'm going to help you with what is showing up on your skin, and we're going to treat that piece of it. and you're going to love it. So based on what you said and based on what we're looking at under the Maglite Together is the fact that you have oilier skin just genetically, and that's great. That's okay. The positive upside of that means that you're going to be, not dealing with aging concerns for a long time. Oilier skin, typically, you look younger for a long time. So that's a great, great thing. So Susie, just make sure you know that I've got you. We're going to use the right products for your skin type and skin condition. And we're going to talk about what ingredients to utilize for you, both in the treatment room and at home. We're going to talk about the treatments that we need you to do and why you're doing them, so you understand why I'm having you come back for 6 to 8 sessions and then get on a maintenance plan after that. And then we're going to discuss home care, what you might have at home that might work, what might not work, and then what you might need to add to it based on ingredient knowledge. It's not about brand, Susie. It's about me making sure you have what you need to where you reap the results. How does that sound? And then she'll be very happy with that. So keep that in mind, that proper consultation is so key. And I just want to make sure you fully understand that skin analysis ties directly into your consultative measures and your client care plans. The way you discuss it is so important. So remember, for those of you that are just hopping on, make sure that you are driving down the road pretending that you have someone with a particular skin type, skin condition, skin concern, and you're talking to yourself mainly to just hear yourself talking through those steps, talking through that care plan, because clients need to know the why. And as long as you can always answer the why question, you will always be successful. And there's so many people out there right now that are looking for good consultations with skincare. I highly recommend you hop on a Zoom call right now, hop on FaceTime with your friends and family, say, hey, let me give you a complimentary skin analysis and client care plan. And listen, I would love to see that, because you practicing this right now is what's going to make you successful. It's not going to happen if you wait a month or two from now. Try it now. Sometimes starting before you're ready is always a good thing. That's what I truly believe. All right, so next slide. Fitzpatrick scale. You've probably heard me talk about this if you're a new student. If you're not a new student, you've seen this, heard this, all that good stuff. So I just want to make sure you fully understand Fitzpatrick scale, because that is a big piece of a lot of aesthetic talk. And if you ever work in a medical spa setting, they will talk about it like it's just regular vocabulary that you would use. So when we're doing laser treatments, we'll say, okay, we're going to do this on a Fitz 3, Fitz 6, go to town, choose this fluence level, that sort of thing. So just keep that in mind, that this is very, very commonplace to discuss Fitzpatrick scale. So let's read what it says over here to the left. It says, utilize the Fitzpatrick scale to track the skin's natural ability to tolerate sun exposure. This scale is exceptionally important for the estheticians regarding chemical peel tolerance, yes, tolerance to laser procedures, absolutely, and more. Many times a proper consultation is paired with an analysis of Fitzpatrick type of the client and thus charted appropriately. So look at what it says. Fitzpatrick is important because that helps me and you determine the safety of whatever it is you're doing for the client. So what constitutes safety measures? When you're doing chemical peels, when you're using different modalities, when you're doing laser treatments, most certainly, all of that constitutes you understanding that safety is super important. And Fitzpatrick scale literally is one of those things. And all this means, by the way, is this: you can be more aggressive on the lighter Fitzpatricks, and then all you got to do with the medium to dark Fitzpatricks is start a little bit less aggressive. Then you can then ease yourself into more aggressive things. All Fitzpatrick types, guys, can do laser treatments, can do microneedling, can do chemical peels. All of them can. It's just about understanding the safety that goes along with that. Does that make sense? Everybody can do it. So when people talk about, well, Fitzpatrick this can't do this, or they can do this, not the case. It really is about easing yourself into it. So if you have questions for me about that, shoot me an email. Say, okay, well, Courtney, I was under the understanding that Fitzpatrick so-and-so, you couldn't do this, you couldn't do that, blah, blah, blah. I'm here to tell you you can, because I've treated skin my entire adult life just about. And I've treated everybody from different age ranges to different Fitzpatricks. And I'm going to tell you, I've done it all to them. I put them all on the chemical peels. I've done it all. So it is very safe. It is just how you ease people into things. Do not be fearful. Be careful. Okay. Okay, so skin Fitzpatrick type 1, it's going to burn, does not tan. So for those people, it really kills me if you really think about it. The red hair, very fair skin individuals that think they can go lay out in the sun and get some sort of a base tan, they say, or lay in the tan in bed. Not the case. They're not going to absorb melanin at all because they don't have enough melanocytes to even do that. Okay, so keep that in mind. Fitz 2, skin will usually burn in the sun and has difficulty tanning. So also don't need to lay in the sun. And what's going to happen is you're going to end up getting a lot of freckling. And that just looks like you're aging your skin, to be quite honest with you. Having some nice natural freckles is one thing, but freckling up your body by trying to force yourself to absorb melanin when you just simply don't have enough melanin in your skin is not going to happen. So keep that in mind. Fitz 3, skin will sometimes burn and will tan gradually. Absolutely. Fitz 3s think that they can lay out in the sun and they're going to get this nice tan and all is good. But I promise you, those folks are still going to get the skin cancers several years later, or at least several years into their adulthood later, and they need to wear sunscreen. So just because you do get a tan doesn't mean you need to not wear sunscreen. So keep that in mind. Fitz 4. Skin will tan easily and rarely burn. 100%. I love a Fitz 4 and Fitz 5 and Fitz 6 because you know why? Y'all get tan and you look good and you don't have to do the spray tan like I do. And that's great. But you are all exposed to the sun. We are all exposed to the sun, and everybody of every Fitzpatrick is prone to get skin cancer. And I don't even know if that's in the slideshow. It's been a while since I've looked at the slideshow, but please go ahead and look up. We have some neat things around the school that y'all can take a look at when y'all come back on site about your basal cell, squamous cell carcinoma, and then malignant melanoma. Really terrible. And I've had clients that have had big chunks of skin cut out of their face, big areas of their nose cut out, big chunks of their ear cut out, big chunks of their hip cut out from people that have been laying in the sun and they just thought they didn't have to wear sunscreen, and that's something you have to live with forever, is being scarred from that. So seriously, sunscreen is so important, and just shielding yourself as much as possible. Also, wearing your vitamin C. Vitamin C is a sunscreen booster. In the morning, you should put your vitamin C on underneath your makeup, or at least by itself, then your sunscreen or tinted sunscreen all set, So the Fitz 4, skin will tan easily and rarely burn. We still need that sunscreen. So Fitz 5, skin will tan without burning for sure. We still want to protect it with sun protection, okay? Whether it's wearing long sleeves or UV protected wear at the beach, wearing hats, we want to keep that gorgeous skin as beautiful as possible for a very long time. Then Fitz 6, skin will never burn and will tan very, very quickly. So Fitz 6 is phenomenal. The only thing about Fitz 6 is you have got to build people up to certain treatments, but you can do it. It's fine. It's really not a big deal. Please get out of that fearful thought that darker Fitzpatricks, you can't do anything. The only thing about darker Fitzpatricks is the skin will have a propensity to hyperpigment, which everybody's prone to hyper or hypopigment, y'all. Just keep in mind that you have to be careful and ease people into things. I promise you, I have done a 6-layer Jesner peel and a Fitz 6 and everything was perfectly fine. And that was a student of mine. So really good results for her, by the way. So keep that in mind. This is all about just how your skin tolerates the sun. And every Fitzpatrick has to wear sunscreen, guys. Don't think that you don't have to. And the only difference here too is how much melanosomes you have in your basal layer as opposed to someone else. Of course, the lighter Fitzpatrick have less melanosomes to absorb sunlight and turn it into a tan, whereas the darker Fitzpatricks do. So who's actually going to be more prone to get skin cancer? It's going to be your Fitz, or who's going to be more prone? It's going to be your Fitz 1 and 2. If you don't have enough melanin, then you're going to be way more prone to get skin cancer. Can Fitz 5 and 6 still get skin cancer? Absolutely, but they're going to be less likely to do so because the melanin truly protects them from a lot of that UV ray exposure, which is great. But again, we don't want to think that we're invincible and we just don't have to wear sunscreen. So still sunscreen all around. Okay. Oh, it's not letting me go to the next thing. Why is that? Oh, there we go. Here we go. Okay, so what does the Fitzpatrick scale measure? The Fitzpatrick scale is a numerical classification scheme for human skin color. It was developed in 1975 by Thomas B. Fitzpatrick, of course, as a way to estimate the response of different types of skin to UV light. So we said that. I thought this was a cool picture, by the way, and great for you to actually put in your lobby and discuss different ways you can treat Fitzpatrick types safely, effectively, and aggressively, folks. Just be careful and ease your way into it. So these are some questions that you might have. This is from our advanced book. So for those of you that are in our fundamentals books now, these are not test questions you would have, but they would be similar. So which Fitzpatrick type is the most resistant to sun trauma? We said that a minute ago. It's going to be type 6. So because type 6 skin rarely burns and tans easily, this individual is less resistant to trauma from the sun, which is great. However, right, we still want to wear a sunscreen. Additionally, type skin has a higher melanocyte count, which provides more protection from the harsh UV rays of the sun. 100%, we said that, we're good to go. Then, intrinsic and extrinsic factors defined. Milady defines intrinsic aging as factors for which we have little control, and extrinsic aging as factors regarding the environment. So let's really break this down because I actually look at this in different ways depending on what activity I'm doing with the students. So sometimes I will say that intrinsic versus extrinsic. Intrinsic factors of aging can be things like food we eat or medications we're taking or smoking, obviously internally is really terrible for you. That would be an intrinsic factor of aging. Extrinsic in that particular instance would be things like UV rays, sun exposure, secondhand smoke, environmental toxins, and that sort of thing. So this looks at it just a wee bit differently. So let's discuss it. It says intrinsic factors of aging can include items that occur internally with which we cause ourselves, which is sad. And extrinsic factors of aging can include items caused ourselves from external items that we come in contact with, as outlined in the 2 upcoming slides. Okay, so look at the examples here. It says intrinsic factors, skin aging factors over which we have little control, which is true. Genetic aging, gravity, which is so sad, right? I want to lift all this up. And facial expressions. Now, we can stop facial expression movement by using Botox, which I love, but we can't perform it, right? We want to go to a physician or a nurse or someone trained to do so. Then extrinsic factors are primarily environmental factors that contribute to aging and the appearance of aging. So sun exposure is always number 1. Smoking is horrible for you guys. Listen, I remember doing that when I was a teenager, and I get it, but listen, stop it. As an adult, I think it smells terrible. In fact, if I ever go into a spa and my practitioner smells like cigarette smoke, that's not good. So if you are a smoker, seriously, you cannot drive down the street in your scrubs going to work smoking a cigarette. It's going to get in your hair, in the fibers of your clothes. Is not good. So be careful if you're a smoker coming to school smoking. It will be something that we actually could send you home for because clients will complain about that, and it's just not good for you. So try to stop that. And then of course, drug use, cumulative stress. Stress is just inherent. We just have to learn how to control it, right? Overuse of alcoholic beverages, of course, that affects your liver. It affects your capillaries. It affects a lot of things. It affects just the way that you respond to things internally. It affects your hormones. I love a good glass of wine like everybody else, but not too much, right? Poor nutrition. So one thing, just full transparency, that I have to work on, I've just said this to myself last night, I have talked myself into thinking that these chocolate-covered cranberries that I love so much are good for me, but y'all, it's not. And especially if I eat them every day because they're covered with chocolate. And I think I've decided that they're good for me because they're cranberries, but still. So it's too much sugar. So maybe if I have a couple of those once a week, that's one thing, but making this my nightly routine during quarantine ain't gonna cut it, is it? So I've got to cut that out. Look at what you're doing every day that's contributing to nutrition, because the thing is, I want to get up and work out every day, but if I'm eating too much sugar or too many carbohydrates to outweigh the exercise that I'm doing, that's really not going to do me any good at all. So it's really difficult. I think nutrition is one of the biggest things that we all have struggles with. And then pollution exposure, that's a big one. I am very aware now about what I'm around. So if I am walking up and down the vista all day long and I'm outside with a bunch of car smog and, smoke, environmental stuff, I will want to go home and shower off before I proceed with the rest of my day, and change into something comfy or whatever the case may be, wash my face, that sort of thing. So keep in mind that pollution exposure, that's something you're probably more aware about as you are an adult. And now that we're washing our hands about every little thing, I think we're all more aware that we're constantly coming in contact with exposure to pollutants, to, pathogenic bacteria, different things that are harmful to us, and we need to make sure we get that off of our bodies. So keep that in mind. You don't want to just go straight to bed or not shower off all of that terrible stuff. So that's going to cause aging too, and clogged pores and many other things. And these are factors you can discuss, of course, with your clients as well. My nose is itching. That's terrible. Okay. All right. So the question is, what are intrinsic factors? Intrinsic factors of aging include examples such as malnutrition, medications, smoking, and alcohol. So that is something we just mentioned. Keep in mind that is what it is. What are extrinsic factors? So extrinsic factors of aging include examples such as UV light, radiation, environmental toxins, and topical carcinogens. Now, topical carcinogens. What is a carcinogen? Anything carcinogenic means cancer causing. Topical carcinogens would be things such as ingredients that are not necessarily good for your skin. So remember how I've always said that I love hydroquinone, and hydroquinone is a really great ingredient for getting rid of hormonal hyperpigmentation. But if you're going to use it, you need to get on it for a little bit of time and then get off of it, right? So that is important. Otherwise, it is known to be a carcinogen, and they've done studies on rats that have, of course, ingested this, had it applied topically, and it has caused cancerous tumors in, of course, animal studies. So keep that in mind, that that is considered to be carcinogenic. Same with ingredients such as benzoyl peroxide, guys. Remember, benzoyl peroxide is an oxygen molecule, but specifically the type that causes oxidative stress. And oxidation is the introduction of oxygen, the reduction of hydrogen, and it is not oxygen like you think of on the elemental table as O2. It is oxygen and oxidative stress that turns, like metal into rust, that sort of thing. So it's not good for your skin long term. If you need to put a client on benzoyl peroxide, I would do so for the duration of no longer than 4 weeks. Get them off of it, switch them over to other things. But that's why I love, for example, I have a product, and there's other products out there that are plasma specific. What causes a product to be termed to be plasma or whatever is it's got an ingredient in it called perfluorodecalam. And that is going to be an oxygen releasing chemical that's non-toxic. And they actually use it in the medical arena for synthetic breathing for people that have respiratory issues. So perfluorodecalam, that is something that's actually another slideshow that I'll probably want to show you guys another time, because that's a very long word, but it is a great alternative to benzoyl peroxide. So keep that in mind. The next question is, what is true of sun damage? Sun exposure causes most of the skin changes that we think of as a normal part of aging. Over time, UV light damages the fibers of the skin. When these fibers break down, the skin begins to sag, stretch, and lose its ability to go back into place after stretching. This is not inclusive of the increased thickening and darkening of the skin due to excessive sun exposure. We need to talk about that. Excessive sun exposure can cause premature aging and even worse, skin cancer. Absolutely. So for your notes, write down sun damage and then examples or characteristics, okay? Increased skin thickening. If you've ever seen, there's something about Mary, and I think her name is Magda, and she's the one that lays out all the time and looks like a piece of leather and it looks a little crazy. That is caused thickening of her skin due to increased sun exposure. I will tell you what's wrong with that other than the obvious is it's very difficult for estheticians to then break that down. It really, really is difficult for estheticians to break that down because the skin, if you see these brick walls behind me, it is very difficult for you to break that down because it's so hardened. The cellular wall has hardened. So that cellular membrane that it's made up of, as we know, has hardened up to the point where it's difficult for us to break it down. So what is your choice? You know, that's why I love teaching you guys things like micro channeling, which are perfect for estheticians to do at the 0.25 and 0.5 millimeter depths, because that breaks the skin open a little bit more so that you can then do your layered Gesner peels that actually break those thicker layers down. So if you're not in a physician environment where you can do laser ablative services, you know, then things like that are going to be the best source of action. Otherwise, the client's going to say, okay, well, I've had this layered Gesner and, you know, nothing is working and my skin's not peeling. It's not breaking down. I see no change. Well, the answer is that you didn't do a proper skin analysis, because if you see that they have thickened skin, and you know what I'm talking about, please look that up. Look up thick leather skin pictures, and I'll probably try to pull some pictures and send to you or post them. But so true, if you do not say to the client, and you can say it in a nice way, but say, okay, you have thickened skin, definitely due to sun exposure over time, laying in the tanning bed, you know that you shouldn't be doing that. But because of that, I want to tell you right here, right now, it's going to take a minute for us to get this broken down. And I want you to have realistic expectations about what we're going to do for you, because we're going to need to do a couple things. I might try to see what chemical peels can do for you, but let's actually look into microchanneling and open up the pathway so I can actually get in there with the chemicals that I can use and break this down. How does that sound? You know, so by you mentioning that up front and discussing that as a first course of action, you will be a lot more successful. Does that make sense? So make sure that skin thickening, if you see it, you need to discuss it. It is okay to discuss it. They're coming to you as the expert. You have to talk about it because the way you treat it is different. And then the next question is, what is true of normal skin? It has an even distribution of water and oil balance would be your answer, but let's break that down a little bit further because, of course, I like a little bit more, right? Although normal skin, and who really has normal skin, right, seems to not need excessive spa treatments and facial protocols, the thought process of the esthetician should be more maintenance focused. I could not agree with this more. And, of course, I typed it, so, of course, I wrote this. But, look, example of a maintenance procedure for someone with normal skin would be as follows. So before I say it, I will say this. When I say maintenance, I mean people that don't need aggressive. So y'all have seen care plans from us before, and it's going to be 6 to 8 treatments of just, you know, really diving in deep. And the point is to get as deep as you can go on your 5th session, so your 6th session is less, or you're really deep on your 7th session, so your 8th session is less. So you do this build up to this really aggressive thing, right? Well, if somebody doesn't necessarily need that, and I hear this a lot from students, they'll say, oh, well, you know, I mean, I had a college student come in and they don't really need anything and their skin looks really good, so we just did a skin rejuve on them. My eyes will start to roll and I will say, okay, no, they need to understand proper maintenance like anybody else. People with normal skin conditions can still benefit from superficial peels, from microdermabrasion, from hydrodermabrasion, because if they have great skin, why not try to keep it that way? Okay, so don't think that they don't need peels and they don't need modalities, because they do. You're just not going to do it as harshly. Okay. So your example would be 3 to 4 week intervals of skin rejuvenation facials, enzyme peels, we'll talk about that momentarily, microdermabrasion, which sands everything down, and then hydrodermabrasion, which infuses hydration. Who doesn't need that? Everybody needs that. But listen up, if you had a question about enzyme peels, let me know, but this is the best way I can explain enzyme peels because every line known to man has some sort of an enzyme peel, right? So enzymes are like little Pac-Men that eat away dirt and debris from the top layers, and that's really it. So it just kind of just very softly removes corneocytes and just makes everything look better. It's just such a happy little peel for people that don't really want anything too aggressive, but people need that. And why do they need that? Because cell turnover is so important for everybody, not just for people that have waited till it's too late, you know, or waited till they have these really serious, crazy skin conditions. Everybody needs exfoliation. Will you write that down, please, guys? Everybody needs exfoliation, not always aggressively. Very superficially is okay for everybody. So stop it with the thought that you can't do peels. Everybody can. Everybody can. Okay? So then notice that the normal skin client does not necessarily need a recommendation for medium depth peels and layered chemical peels combined with microdermabrasion during the same session. So true. These aggressive treatments can be saved for more serious skin conditions and need-focused skin conditions, which is what we focus on the most. But you might have people that are just coming in for maintenance, and this is how you would treat them. You would do a microdermabrasion facial by itself. You would do your hydrodermabrasion facial by itself, like the hydrofacial. You would do a radiance reset facial, which is just your double cleanse, your peel, your mask, and then your massage. You don't have to combine all these different modalities to really get this aggressive result. You can do things one at a time. In enzyme peels, there's not just one type of enzyme peel. There's many and a multitude of different ones that suit people like this. So keep that in mind. And if you have any questions about how to treat normal skin, and I say that in quotes because who really has normal skin, but there are people that are in maintenance, and listen, let's praise those people because they've kept up their skin and they're coming to you to keep it up. So don't just play it too safe, and don't just do skin rejuvenation facials, guys. Add in something that's going to give them a long-term result. Don't just always think short-term. Think long-term, okay? The next question, what does dehydrated skin lack? I remember this when I went to esthetician school, and I remember, and I'll read this and then I'll tell you what we did. So the answer is dehydrated skin lacks water in the underlying layers of the skin and thus can look crepey and lackluster. So do y'all know what crepey looks like? I don't know if you can see, but what you need to do is hold up your skin and pinch it. And my hand is pretty hydrated because I put all my serums on there. So I'm good to go here, but maybe in another part of my body, like my leg or something, it's going to look more crepey. And crepey means that it's going to look almost like crinkled up a little bit. And you can just pretty much tell when someone has dehydrated skin. So you can be oily, by the way, and still have dehydrated skin. So what's the answer there? How would you treat someone for that? It would be, of course, a ton of water intake internally. There are tons of folks and tons of medical spas that are opening up the IV infusion bars as a part of their practice. Now, I have never done that. I would not be opposed to doing it because you were getting that big influx of hydration through an IV infusion. You can also get the vitamin C ones, which would be perfect for right now and everything going on. So different things like that. Of course, the hydrodermabrasion, y'all, that infuses antioxidants and hydration into the pores, which is phenomenal. And they truly would be really well off with a serum-based hyaluronic acid that attacks from all levels of the skin in order to really see the results of adding in topical hydration that way. If you just do it with a cream or a lotion, it's going to sit on the top. Remember, serums get down a lot deeper, which is why I'm a big serum fan. You want to get way down deep and really treat those underlying layers of the skin in order to hydrate from the inside out, so keep that in mind. So look at what it says off to the side here. 5 causes of dehydrated skin would be outdoor environment, hot showers and baths. That's hard for me to say no to because I love my hot bath, right? Air conditioning, harsh chemical skincare, and then poor diet. Okay, so keep that in mind, that those are causes of dehydrated skin. You could do a whole, education series on social media today about dehydrated skin. What can we do to fix it, right? Doing all of those things, such as internal water intake, eating your water. If y'all actually like Dr. Murad, he has a skincare line that I'm sure you've heard of, but he's got some really great books, one of which is called The Water Principle. And he talks about eating your water through cucumbers and watermelons and things like that, things that have water built into it. And that's not only going to give you your vitamin and supplementation, right? Your antioxidant support, but it's going to boost your skin with tons of just water from those food groups. So that's a great thing. But then also addition of serum-based hyaluronic acid, which we know hyaluronic acid binds water to the skin. And then these squalene infused serums, such as the lipid drops that everybody's obsessed with, that is a big one. That binds tons of water too. So think about ways to do that. And I'll tell you, people that also need to bind water to their skin are folks that have eczema and psoriasis. People that have that very just, misshaped, what is it, a desmosome. It's going to cause those cells to rub together and cause friction and irritation. You can also have an overactivity of mitosis, which causes excessive skin and irritation that way. So oftentimes they are definitely lacking hydration because they're dehydrated due to excessive shedding or whatever the case may be. So a lot of those skin sensitivities need hydration. But even if you don't have those skin sensitivities, you can still have dehydrated skin. Okay. Then the next question, what type of skin is indicated by redness and is the result of distended capillaries from weakening of the capillary wall? So we mentioned this at the beginning of the talk. So we said, and I didn't use this term, so here's a bunch of terms for really the same thing. Broken capillaries. So broken capillaries can look like those little red veins around the nose, if you can imagine, but it's also known as something called a telangiectasia. Okay. Then if you have a ton of telangiectasias or broken capillaries in one space, you will then have a condition known as rosacea. Rosacea looks to the naked eye like it's red and just irritated cheek areas and that sort of thing. But if you look at it really closely, it is in fact a bunch of telangiectasias or broken capillaries, really teeny tiny like, okay? But then another term for rosacea, okay, is Couperose skin. So everybody say that out loud with me. Couperose skin. Couperose skin. You will hear that on state board, and I just want to make sure y'all all understand that you can put these words in a line and they are all in the same family. So broken capillaries, telangiectasias, rosacea, and Couperose skin are all terms for pretty much the same thing. Does that make sense? If it doesn't, let me know. All right, so let's read here. It says rosacea is a skin condition that can be treated. Yes, it can. And it aggravates me when people think that it can't, because it can. I'm telling you, it must be continually treated throughout the lifetime of an individual prone to having broken capillaries with a lighter skin tone. So most certainly it is genetically induced. People with a Fitzpatrick 1 especially, or even a 2, are very, very prone to rosacea. The more you aggravate rosacea-prone skin by eating a lot of spicy foods, or what else? Drinking a lot of alcohol on a regular basis, you are going to have more reddened skin, most certainly. And even if you've seen older men that aren't necessarily rosacea prone, you can throw yourself into having a red bulbous nose. If you think of those men that drink a lot and have the big beer guts and that sort of thing, and then they have all this redness in their face and then their nose starts getting bigger, that's called a bulbous nose. That's really unfortunate. And that's a huge sign. Your skin is pretty much screaming, help me, because you're drinking too much alcohol and eating too much high cholesterol foods. So rosacea is honestly a sign oftentimes for people to really back off of what they're doing internally to cause this. I will say that. Now if it is a very just light issue of broken capillaries here, we can treat that, with lasers and that sort of thing. And it just zaps them away. It's really cool. But if people continue on with the issues that they are not going to get away from, that are self-induced, Rosacea can occur for a lifetime. So that is another big one that you want to consult with them about and do a proper skin analysis on. Okay, not all clients with cuperose skin have rosacea. Now, that might be a confusing statement, but so true. Cuperose skin can be skin that is just red, indicated by redness for sure. But people with rosacea, that is a, what's the word? That's a diagnosis that a lot of dermatologists might give someone. But again, to me, it's really all the same thing because it truly is. If you look at somebody and look at pictures of folks with cuperose skin versus rosacea, is very similar. And just because somebody's been diagnosed with rosacea doesn't mean you can't treat it. So keep that in mind. You most certainly can treat it. Okay. What do occlusive products reduce? So occlusive is your vocabulary word here. And yes, you need to know this for state boards. So occlusive products act as a physical barrier to prevent water loss in the skin. Okay, let's read on, then we'll discuss. Occlusive products are not effective for those with oily, acne-prone skin or that deal with comedone creation easily. Occlusive products can often prevent oxygen flow within the skin, which can breed bacteria if used excessively. So I will give you a big example of an occlusive product, and that would be Vaseline, okay? Why do I like Vaseline though? What can we use that for that's a positive thing? If you think of the dry skin on your heels, or if you have a scrape on your knee or something, applying an occlusive product does exactly what it says. It prevents water loss, and it specifically prevents something called transepidermal water loss, which just means water loss from the skin. Easy enough, right? But occlusive means that it's causing a physical barrier. So my question to you, is that good for oily or acne-prone skin types? No. So if you put anything on the face for people that have acne or oily skin, okay, that have petroleum jelly in it or have other occlusive ingredients such as mineral oil in it, which is the worst, that is called an occlusive product, and they're going to break out and their skin's not going to be happy with them. So really ask me questions on this one too. Occlusive products aren't good for everybody. If you're one of those that's sitting here listening to this and you can say, well, I've been using Vaseline my whole life and my skin is perfect. Well, good for you. And that's great because it is genetically predisposed for you that you can probably just do just about anything and you'll be okay. But I will tell you the problem with this, just because you don't break out, look at what it says. It prevents oxygen flow, which can breed bacterium. That is a problem that you can have. So if you don't have acne issues, you're definitely going to have a bacterial infection that can occur. So I would really consider getting away from the occlusive products on your face. There's plenty of nice clinical grade ingredients that can help you get that hydration you're looking for, guys, without the, just completely shutting off of oxygen flow to your skin. We need that. So occlusive products are not great in many ways for skincare here, but occlusive products can be fine for, very cracked heels, or what if you have a fever blister and you have cracked lips? People might use occlusive specific lip balms in order to heal that. That's one thing, but a daily occurrence of occlusive products for use on the skin, not going to be what you want to do, okay? Then, when should you analyze the client's skin type and condition? The answer is prior to the service, so let's read here. It says, skin analysis is one of the most important aspects of a facial service, as the esthetician will determine what what skin type the client has, what products are deemed appropriate to its conditions, and what treatments are needed. Proper consultation allows the esthetician the opportunity to ask questions about the client's health and skin concerns and advise them on proper protocols and plans of action for true results, okay? Very true. So skin analysis, again, you want to look at the skin and you want to look at the skin and you want to look at the skin for sure, but you also want to ask questions. So the questions that we mentioned in the very first half of this were, what is your skin type, or what do you feel like your skin type is? Is it oily, dry, or combination? What skin conditions do you feel like you have? Rosacea, acne, hyperpigmentation, what's going on? How can I help you? Dehydration, of course, is another skin condition too that we just discussed. What are the conditions? Remember, skin types are genetically predispositioned. conditions can be treated. We always want to analyze the skin prior to the service. Then, what are the general characteristics of type 3 skin on the Fitzpatrick scale? So this is just a question you might get asked, whether it's this way, essay type, or multiple choice for your theory exam. The answer is going to be light brown, sometimes burns, slow to tan. So that's a type 3. What is type 4 skin on the Fitzpatrick scale? We said earlier it was medium brown, brown eyes and dark hair, burns with very little or very lengthy exposure, always tans easily. But again, what did we say about all these skin types? From type 1 to type 6 on the Fitzpatrick scale, everybody needs sunscreen always. You are not immune to skin cancer issues, not one of you. So just make sure you're wearing your vitamin C and then putting your sunscreen on, and that is so important. And FYI to you, there's a lot of really terrible occlusive ingredients in a lot of over-the-counter sunscreens. So remember, clinical-based sunscreens are going to be buffered or kind of actually spread out a little bit with dimethicone, which is a silicone-based ingredient that causes it to be more spreadable and a lot more lightweight on your skin. So if it feels very tacky and sticky, that's not good for you. That's going to cause a whole heck of a lot of breakouts, and you can put that in the occlusive family for sure. But sunscreens, it's not one size fits all. You have to find the one that's right for you. Then, I love this term. What are contraindications? A contraindication is a condition or factor that serves as a reason to withhold a service or be cautious of providing a service due to the harm that it would cause to a client. Okay, so we'll say this bottom thing and then I'm going to discuss it. Contraindication is the opposite of indication, which is a reason to use a certain treatment. Okay. So here's what I have to say about contraindications. Contraindications can either mean don't perform the service, or it can mean that you need to be cautious of performing the service, okay? So in your textbooks, it might say that herpes simplex 2, or is it 1, the fever blisters, right? That would be a contraindication to a facial. So here's what I would say about that. That doesn't necessarily mean you cannot perform a facial. That just means you need to go around that lesion, right? So contraindication either means don't do it altogether, or it means be careful of and go around it. Another example of a contraindication, a complete contraindication that would mean do not do, would be, let's think, people that are taking blood thinners and getting microblading of their eyebrows. That would be a complete contraindication, because I'll tell you why. Number one, the doctor will not clear them, and here's why. If they are bleeding too much because they're taking blood thinners, the pigment will not sit or settle in their skin at all. So therefore, it's really pointless of them to be laying there and getting that treatment done to begin with. Am I right? So it's there for a safety reason. Now, that really is something you have to teach people. They have got to understand all the do's and the don'ts prior to even making an appointment. Otherwise, they're going to get really aggravated when you have to tell them, no, I can't perform this because you're taking blood thinners. Or if you have them scheduled for a layered Gesner peel and they have just applied Retin A, which is prescription tretinoin, on their face the night before, that's a complete contraindication. That's basically like putting a peel on top of a peel, and what's going to happen is their skin's going to bubble up and then turn into a scab. And we don't want that. That will overprocess their skin majorly. So that would be a complete contraindication, 100%. People have to be off of prescription tretinoin for 7 to 14 days, whatever the physician suggests in their practice, okay? And then you will move forward with the service from there. Now, will people lie to you on their intake form? Yes. So you really have to develop that relationship to find out if they have any contraindications before serving them. That's what this is all about. That's why you're here, is to learn the proper and safe way to do things so that you know what a contraindication is, whether or not to perform the service for the safety of your client. Okay. Then the next question, what type of skin ages more slowly than other types? The answer is oily skin. We mentioned that earlier. So here's what it says. Oily skin is characterized by increased amounts of lipids, my favorite thing, on the surface of the skin due to overactive oil glands. Oily skin can weather the effects of aging due to its natural lipid structure that decreases the chances of wrinkling taking effect. And I think that I spelled weather incorrectly on that slide, but that's okay. So, oily skin has excessive oil or increased amounts of lipids on the surface. So therefore, it's going to kind of fill up those areas that would be more dry and crepey. So they're just inherently going to age slower, which is the positive. But on the flip side, oily skin really has to be concerned with acne lesions and the propensity for people to pick at them and then cause post-inflammatory hyperpigmentation and other things that just make oily skin not so fun to deal with. So once you kind of figure out what works for you and what sort of routine to do at home and how to alternate serums and what ingredients to use, what ingredients not to use, you will be a happier camper with oily skin. But if you don't understand that, you can really suffer with oily skin and have these issues for a long time. So if you're someone that's been in our program and you're still dealing with really oily skin and breakouts and that sort of thing, and you're really just fed up with it, please get with me, because I promise you I can help you, but it's going to take some communication between you and I to develop that. And you have to be consistent. So much like we tell our clients to be consistent, you also have to be consistent with your routine to get rid of what's going on. So oily skin can be fine, but it can also be something that really plagues people. You can work with it and make it a good thing. Okay. Then, what is a characteristic of sensitive skin? Sensitive skin is a skin condition, not a skin type. Oh, I could talk about this for hours. It is characterized by fragile, thin skin that reddens easily. So subjective symptoms can include stinging, itching, burning. Y'all know I don't like that word. And or visible skin changes such as redness, dryness, scaling, peeling, or hives. You can train people with sensitive skin. Now, whether you believe me or not is up to you. But I have had plenty of clients that just really feel that due to sensitivities they have had to previous treatments in the past or to products they have used that have caused them to be itchy or sting or something or be more hive-like, that is quite okay, but I can work with that, and here's why. People with sensitive skin, they don't need to use fragrance. They need to use things that are mostly natural, nurturing ingredients, but you can maybe throw in an acid, let's say, once a week, okay? You can build them up slowly from enzymes into superficial to medium depth chemical peels, okay? And then if somebody gets hives from a lot of things, that means their histamine response is very, very active. And that's okay too. It's just how some people are. It's either genetic or is their mast cells and their dermis just going haywire, and that can be a little bit of a predisposition, of course, genetically, but also they can be just really sensitive to a lot of things, and they've built up this space with their mast cells to where it's just going to be on edge, at all times. So people like that honestly could do very well with taking a Claritin every day for allergies, in addition to taking a Benadryl before or after their treatment with you, and it will help calm that down, I promise. So there's a lot of things that sensitive skin can really be from, and oftentimes allergies or irritations that come from, you dealing with hives, that can be treatable too, so a lot of it has to do with internal stuff, and that's why we love speaking on internal versus external, because your skin is simply a reflection of what's going on inside. So keep that in mind when you're treating sensitive skin. It's not something that you just have to say, no, I can't treat you. Say, come on in, I can treat you, we can work with this. Then the next question is, what type on the Fitzpatrick scale is a person with fair skin, light eyes, and lighter hair? That's a question that could honestly, in my opinion, be type 1 or type 2, but the answer here is type 2. What type of skin on the Fitzpatrick scale is a person with Mediterranean Caucasian skin and dark brown hair? The answer is type 4. So you really do need to study in your books the chapter discussing skin analysis, because it's going to talk about specifically culture-specific areas of the world like this. Whereas I like the more generic definitions of the Fitzpatrick when it's just discussing, frankly, you know, how the skin tolerates the sun. But you might have questions like this on state board. So that's why I wanted you to be exposed to that today. This one, what type on the Fitzpatrick scale is a person with very fair skin, blonde or red hair, light colored eyes, and possibly freckles? Type 1. That's a very fair assumption about that question, type 1. And then you all have seen this stuff, but I want to encourage you to pull this up again in Edmodo. If you guys need access to Edmodo again, shoot me an email also. Now, remember, I'm getting on this call at 10 for 2 hours, so I will not be available to answer any emails until after 12 o'clock. Just keep that in mind. But look at the intake form. You know, look at it again. Look at the medications you need to be looking for. That's really, frankly, right there at the top, right up under their general information. Keep in mind that is a big deal. People's personal health histories, any conditions that apply to you, skin history. You know, so those are great things to look at and go over. And, you know, this is a very brand neutral intake form, and you can add your logo to it, make it your own, add other questions if you want. But this gives you a good guideline to go by for sure. Then, of course, the big piece of it, and we're almost to an hour, so I just want to make sure that you see this and you can go over it on your own. But spa protocols by skin condition, this may or may not be my updated one, potentially. I bet you it's not for my second edition, which you do have access to on your Edmodo account. But just look at it. Your acne grades 1 and 2, this is a suggested cure plan. But where would we customize this? We would customize this based on really other things like their skin type, whether it's dry, oily, or combination, and also their Fitzpatrick type. What did we say about Fitzpatrick types in the beginning? It doesn't matter what Fitzpatrick type you are. You can do it all. You can layer up and do a 6-layer Jesner on a type 6. Yes, you can. And if you don't believe me, watch me. I will do it. You just have to ease people into these things, okay? Then here's some suggested spa protocols by skin condition for other things like grades 3 and 4 acne, fine lines and wrinkles, hyperpigmentation, and so on. Over here to the right, you have spa protocols by skin conditions for body issues, such as keratosis pilaris, body treatments like acne and acne scarring, other body treatments like hyperpigmentation and aging. Seriously discuss and sit down with that client about what it takes to get from A to Z, and to make sure that they feel like you understand and you are explaining to them the why. Why am I doing this first treatment this way for keratosis pilaris? Why am I going into this next round on the second treatment? Why am I going into doing that glycolic 30% peel on the third treatment? Explain to them why. You are not the expert, folks, until you can explain why on every single one of these line items, and that takes some time to learn. But I love educating you guys on this in the very beginning because you have 20 or 30 weeks, depending on what program you're in, to gain that information. It's all very buildable. So start with your firm understanding of these ingredients. If you need more information on that or need me to send you the link to any of the previously recorded education pieces on ingredients, please let me know because that is a very important thing that I want for you. Okay, these are some recommended home care by skin condition. I find this to be very important as well. So specific to ingredients only, not by brand. Okay, I really want you to hone in on that. And again, this all goes back to your understanding of ingredients. And that is my last slide. So again, we started this lesson at 8:30. If you didn't hop on until a little bit afterwards, I'm going to send y'all the recording. I love you guys. I'm going to hop on and do our advisory committee meeting at 10 o'clock. So if you know any spa owners, shoot them a cell phone number. They can definitely join in. But I love you guys very much. Shoot me your 3 points that you learned from today's skin analysis lecture. And I hope that it inspires you to just be the best that you can be. Okay. I love you guys so much, and y'all have the most awesome day ever.